we know that Mr. Braun won't bring any harm to Miss E.B. or anyone else for that matter?
Well, like I pointed out earlier, the delusion only extends to Miss E.B. So there is no real danger to the greater population. And when Mr. Braun does undertake this treatment plan that I've suggested in my report, it does show a very high success rate. In Faden, Ravine, and Misery and Wang's 2017 study, there was no danger that would be suggested to Miss E.B. And it just suggests that Mr. Braun would in fact be a good member of society once undertaken this treatment plan.
A high success rate? A high success rate? How high does the success rate have to be?
Well, in some studies, I found that only when antipsychotics were used, that unfortunately some patients did in fact try to contact the person at the center of their delusion. However, through Faden's further study, they found that a combination of treatments showed a high success rate. I was unable to find the exact percentage. However, it was proven by other further studies as well.
You mention in your report that this disorder is rare. How is it then that he was diagnosed in the first place?
It is important to note that whilst a case or a classification disorder may be rare, this isn't a point of just dismissing it. The low frequency doesn't mean that the diagnosis that I've currently made on Mr. Braun is invalid. However, it has undertaken a lot of classifications and making sure that it is valid, and through this he was in fact found to have had it.
So, I guess my final question then is, how can we be sure that he won't just become a stalker and will try to find another victim of his so-called delusion?
Well, I think it's important to note that there is a distinct difference, and he has in fact suffered a mental illness, and that this disorder, once treated, will show no longer that Mrs. Braun will be the central of the delusion. The delusion, after extensive treatment, will no longer be present. And you can just look at his previous history, and he's never displayed any issues behaviourally apart from this current abnormality. He has only suffered in his life depression, but that is not an indicator of future mental illness or any other behavioural issues. He is in fact been shown to be a model citizen, and once this disorder is addressed, he should be a productive member of society again.
No further questions, Your Honour.